Hello, my name's Dr. Rob Lown. I'm a haematology consultant from Southampton. I'm going to talk you through staging for lymphoma and talk a bit about what it means, what the stages are, and what the implications are going to be for your treatment. So, what is staging? Staging really describes where in your body the lymphoma is. And staging is important for a number of reasons, not least because it helps guide the treatment that we give for lymphoma. Now, we use a staging system called the Lugano staging. And essentially, this is split into 4 stages from stage 1 all the way through to stage 4. Stage 1 lymphoma is usually just in one or a couple of lymph nodes that are very close to each other. And usually they will be on the same side of the diaphragm. Stage 2 is where there are more than one or closely related lymph node groups involved, for example, in the neck and in the armpit, where they're quite separate, but again, they're both on the same side of the diaphragm, either above or below. Stage 3 is where you've got lymph nodes both above and below the diaphragm. And then stage 4 lymphoma is in places outside of the lymph node. So this could be, for example, in the skin, in the bowel, or sometimes in the lung or other parts of the body. Now, we often put stage 1 and 2 lymphoma together as what's described as early lymphoma, and stage 3 and 4 as advanced stage lymphoma. Now, we also use a lot of letters after our staging. The one that people come across most commonly are the B symptoms. So if patients have B symptoms, which include weight loss, night sweats, or fever, which is unexplained, then they will have a letter B after their stage. Whereas if they don't have these symptoms, they'll have a letter A. So we can have stage 1A, we could have stage 3B, stage 4A, any combination of those. Now, of course, lymphoma is a blood cancer, and lymphocytes, which are our immune cells, and these are the cells that go wrong with lymphoma, are found everywhere in the body. So whilst they spend a lot of their time in the lymph nodes, they're in the blood, they're in bone marrow, they're in the skin, they're in every tissue of our body, helping to protect us against infection. And for this reason, lymphoma often can be quite widespread. And the other reason is many types of lymphomas don't cause too many symptoms. And so patients can have had the lymphoma for a long time before it makes them unwell. But lymphoma is different from other cancers. And you may have read about stage 4 disease being associated with being inoperable, incurable. We often hear these words. But in my experience, even very advanced stage lymphoma can be very treatable and the prognosis can be very good. And your doctor will be able to talk this through with you in more detail. Thank you.